burnout epidemic, I like to believe, is vastly attributed to this constant disconnect that we have between the system and our profession. Like you were saying, the culture of being tough and being rigid and cold and cynical and dark humor, and like it's looked at as almost a positive, like you're in the club if you can become that.
This is A Silent War Within, the podcast dedicated to confronting the unseen mental health battles carried by our first responder and healthcare heroes. This show is about real stories, real struggles, and real ways to survive the storm and come out stronger on the other side. For too long, stigma has kept you silent. But this is your space to bravely break that silence, share vital insights, and build a community where your well-being truly comes first. Because your service deserves unwavering support.
Well, hello again, everybody. You're listening to A Silent War Within. I'm glad you could join us today. As always, I always encourage you guys to rate the show, leave a comment, interact, follow the show. That just tells all the platforms that we're something people want to listen to, and I appreciate you guys that have done that. And of course, you can find us on all the social media platforms, YouTube, TikTok, Facebook, Instagram, all those places. And we have a website that I always like to tell you about, asilentwarwithin.com. You can find us there. Today, we have somebody that I've followed for a few months, and I really have enjoyed her content. She's opened my eyes to kind of a new world of paramedicine that I did not think about. This is Medic MaGill on TikTok, also known as Sam, obviously. Glad to have you with us today.
Hi, yes, thank you for having me. I'm excited to have some great conversation.
I'm very excited to hear about mobile integrated healthcare. You guys may recognize that term, may not. It's what we in school always refer to as a community paramedic. You may be familiar with that term a little bit better. And when I discussed this prior to the show, and some people don't know what mobile integrated healthcare is. So part of the show, we're going to get into this and kind of talk about it a little bit and figure out what it means for EMS and how we move forward with it. But also, Sam, you're an advocate for mental health. You do a lot of posts about mental health and a lot of content about mental health as well. And you kind of had some moral injury yourself that we'll get into and a lot of other things. So this is going to be a great show. I'm really excited, but always first and foremost, I want to acknowledge that you are so authentic on your page, and we love that. That's the people we go after.
Yeah.
It feels like you're having a conversation with me every time I'm watching your content, and that's important. That's how you become a great content creator, and you're well on your way. But tell us about your origin story. Tell us about where you came from, how you got into EMS. Who
Yeah.
is Sam? Not Medic MaGill, but who is Sam?
Yes. So I started my EMS career about 10 years ago. I started really on the volunteer side of things, small service, strictly volunteer. Just one of those things. You see a little Facebook post said, "Hey, we need help," and so joined up that day, got a pager that day, started that day. So really dived into that just to get more curious, started responding as just a strict first responder, instantly fell in love pretty quickly, decided to go to EMT school within that vicinity, and it took off from there. Got into EMT school, then I started doing patient care tech work actually in a hospital. I always like to say my origin story, it was the true saying of like curiosity killed the cat. Did everything. I got my 911 feet wet starting on that volunteer side, but then quickly moved into, the patient care tech at the hospital, did a stint. So I went and got my paramedic pretty quickly after I actually had to get done with college, and then went and got my paramedic quickly after that. And once I got my paramedic, I started part-time work in rural county services. Did a stint in the ER when they introduced paramedics into ER roles, and then went into rural hospital-based paramedicine, which is actually where I'm currently at, and kind of full steam ahead with the mobile integrated health there and community paramedicine. So really just kind of dove my feet in a little bit of everything. I liked the clinical aspect of the hospital, and now mobile integrated health, moving into more of those non-emergent roles for the paramedicine field. I also now am kind of sitting on a subcommittee board for the state of Iowa for mobile integrated health. So diving a little more into that policy work, framework, legislative aspects of our great field too. So a little bit of everything.
Very nice. So
Yeah.
were you one of the kids that kind of always wanted to do something public service related, or was this something that just grabbed your attention off the web and you said, I could do this?
Yep. So I wish I could say that this was my lifelong dream. I will say I had an incredible grandma that was very involved in raising me. She was a first responder for 34 years. So we always were kind of familiar with the tones going off. And I mean, she was an incredible, incredible lady, was always there to help. I mean, even outside of that. And so she definitely showed me the true selfless service kind of lifestyle. And I think that was probably ingrained in me. I don't know if it was a direct correlation, but yeah, I always think about her and now that kind of where I'm at. She was definitely a big inspiration into kind of, I think, that motivation to serve. I don't think I knew what it was. I went to college, got a bachelor's degree, and that was kind of when I started in the volunteer side. So I was like, right, I thought I was going to go into business. And then that volunteer service was really what made me feel like, oh, maybe there's something here. And then the further I moved into it, the more it really just stuck with my true alignment, I feel like, of who I was. I mean, I was growing up too. I was young. And so, you don't really know who you are when you're going through college and all that. But yeah, as I started to grow up, it seemed to really, I wish I would have known about it sooner and earlier. I think I maybe would have had a few less $1,000 pay off of my bachelor's degree.
Yeah.
Not that I don't regret it. I think it was all a great experience, but yeah, ultimately I think I knew it was going to be what I was going to do. I just didn't know it back then.
What'd you get your bachelor's in?
Business, very
Ooh.
basic. I didn't know what I wanted to do for 4 years, so I was like, "Oh, I better get something or my parents are not going to be happy."
When I acquired my bachelor's in healthcare management, I told everybody I interviewed with, and it probably was not a great thing to tell, but I was like, "You do not want me managing your finances in a business." I was like,
Right,
I will break this company because every single finance class I struggled in,
right.
just very difficult. I do not like finances."
I mean, that's the crazy part is I think a lot of people have that origin story of like, right, they started somewhere, they just weren't really sure, like, but they kept
Mhm.
going, kept
Yeah.
moving along, and then something happened. It's either usually a life event or, right, experience or exposure to the EMS or pre-hospital world, and that's kind of what brings them in. I wish it was a little more talked about when in like your career fairs and things like that about being a first responder and what that career field and path looks like. But I'd like to think that most of the time people have some pretty interesting ways they got into EMS.
Yeah, and one of the videos that you did that I can only assume is about you that resonated with me is you were talking about this moral injury, this identity wound, and you kind of afraid to leave one place to go to another. Can you tell us about that situation without revealing too much detail?
Yeah. Yeah. No, yes, I have not really talked about this a lot, specifics on this story, but I'm more than happy to. So like I said, I started my career in a small service. Even though I worked PRN other places, I feel like that service was always my home. Like it was my home base. We were a very tight knit group. Like I said, small service. You get really engulfed into that like brotherhood, sisterhood very quickly. I was young, passionate, very proud to be there. So that sense of identity formed really fast, and I didn't question it much because I feel like when you're that young in EMS, you kind of internalize the culture around you because you just are ready to take it on, and you call it what we kind of all call it is the brotherhood or sisterhood or and that tightness. And right. So then, like I said, I grew up and the service started to change. It was a kind of like your public city government service. So our new city leadership and shifting politics and stuff, things started to feel off. I started taking on a role more in like an administrative level. And again, it was one of those things where smaller services, like you kind of get put into these positions where not that I wasn't prepared, but I was just, right, you're kind of drinking from a fire hose. So it was hard for me to really discern a lot or reflect a lot on like what was going on. But dynamics were definitely changing. A lot of situations just started not feeling right with me. Right, there was a lot of internal conflict I just couldn't really ignore, or at least got to a point that I couldn't ignore anymore. But I didn't really have the language of like, oh, this is moral injury, or oh, I didn't know what that was. But I did know that like something in me kind of knew like this can't be your home anymore. This can't be like where you grow in your career anymore. And yeah, I would say honestly, so I left. Leaving was not fun. Even though I knew I had to go, it was like ripping one stitch at a time out of 1,000 stitches of, your body. Like, it was not fun because it was like I didn't realize how much my identity formed into that place until, right, you leave. So it was not freeing. Honestly, and not to sound dramatic, but it felt kinda like grieving a death a little bit.
Mhm.
And it's probably sounds crazy to people that aren't involved in this field to say that. It's like, "It's just a job," and it's like, it's hard to explain to people. But yeah, I really lost a version of myself I felt like I had built my entire early career on, so it was sad. But I stepped back, and it gave me a perspective. Like, once I left, I got a perspective of just how conditional the environment was that I was in, and it depended truly on me fitting into that system, being a certain type of medic, a certain type of, accepting certain things that maybe I wouldn't accept otherwise if I knew more, if I knew the bigger world of EMS. So looking back, it was extremely dysfunctional. I did not see it at the time though. I had to leave in order to kind of see this all and heal outside of the environment. So navigating that, right? I really starting to name what it actually was, or even figuring that out for myself. I always advocate for a mental health services, therapy services for any first responder because those people are, I mean, obvious. They can see it in an objective sense, kind of talk you through it and give you the right resources to hopefully not make it something that you internalize too much and, right, kind of spiral. So, right, went through all of that, understanding the discomfort, understanding it wasn't weakness, it wasn't I couldn't hack it, couldn't cut it down at that system. It was moral injury, and it was recognizing that the values that made me want to be a medic were actually just being compromised by the environment I was in. Once I saw it clearly, I feel like I could definitely move forward. It was like a shift, a huge shift, and that's what I was trying to capture in that video that I'm assuming that you were referring to, that you saw, because it was a very night and day difference. Once I was able to like, oh, this is like you resonate with that moral injury definition and you start to read up on it, it's like, "Oh, it makes sense now."
Yeah.
And, that's why I get so passionate about this, and I'm sure from my stuff and talking to me, you'll see I get very passionate about a lot of things because I see this profession as a lot of people that similarly to me, even if you have a different story or any like, it's a lot of people end up in these situations that don't feel big at the time, and then you shift or move, and you're like, "Whoa, that affected me so much more than on a professional level." So, right, I think a lot of providers have that same fracture, but they just don't have that language for it yet. So that's why I try to put that out there, as uncomfortable as that is sometimes. I think it is really, really important for us to move forward and as we progress through his career to talk about.
Yeah, that is a great point, and I love that you are passionate. It's a great thing, and I think that's why your videos resonate with people is because you are passionate. You are showing that you care so much about something, and I totally get the being at one company. I was at one little rural EMS company for, and I say little, we had like 13 counties or something,
Right.
but I was at this one company for so long. I would even say I bleed blue because that was the color of their uniforms, that was the color of their trucks, and that's what I thought. Even when I left, I eventually came back for another stint, and even after all the moral injury and the leadership betrayal and some of the things that I experienced, I still wanted to be there. It was still kind of that family dynamic that I just wanted so bad, and you're exactly right. Once I left and left for good, I was like, "Oh my gosh, that affected me in
Mhm.
ways that I was not even aware."
Mhm.
And just made me have big trust issues for a little bit. With any leadership, even the good leadership was facing the same uphill battle with me
Yep.
that I was just untrusting of anything they did. So, I mean,
Yep.
I completely get that. One of the other things that I heard you say in a video is this phrase, just a paramedic. We constantly say we are just paramedics. Elaborate on that a little bit because I really like that one as well. And we'll go through a few of these as we go through because one of the things I enjoy doing is getting guests from TikTok, especially. I think it's one of the greatest communication tools that we have. You can speak to thousands of people all at one time.
Right.
So just elaborate on that a little bit about this
Yeah.
just a paramedic myth.
Well, so just a paramedic. I just think that phrase is incredibly discrediting to the profession, to be honest. And what's interesting, and kind of what you were talking about earlier, when we talk about like leadership and these systems that end up with moral injury, it's a fracture in what people understand paramedicine is versus what it actually is. And I think that's what ends up happening a lot as we get into these systems where people are leading that actually have no idea what we do. As to really make my point with the just paramedic, I don't think it started with bad intentions. clinicians. I do think most medics are inherently selfless. I feel like we see ourselves in the way that many other like healthcare disciplines see themselves. Like you're truly just wired to serve. And so I think the phrase originally came from humility. Like, hey, I'm just a good old paramedic. I just, I'm not above anyone. I'm here to help. I'm here to do, it came in this like humility, teamwork sense. And it was an internal trait that I think we said about ourselves. But then I think somewhere along the line, it definitely shifted. It stopped being out of our humility and started being something I think more people said about us. So then it was more like, they're just the medics. Well, aren't you just a medic? Can you even do that? And so it actually kind of shifted and became this external label, but an extremely limiting one. Because when you think about it, like we aren't just anything. I mean, we have a host of what we do. We are truly a gap service. We fill a lot of holes that other people just couldn't even imagine doing. We're clinicians, we're decision makers. We're often the first medical contact someone. I say that a lot of, like we are that forefront of what people think medicine is. And right now we're even seeing paramedicine moving beyond our emergent settings and MIH. So it's, again, we minimize it when we say we're just anything. And even if it's on accident, we're reinforcing that narrative that keeps us undervalued and ultimately, I feel like, keeps the profession stagnant, if not regressing.
I would completely agree with that. And one of the things that I think fuels that, a little bit that's just a paramedic is outside disciplines, the public can sometimes see us. So, quick story, I can remember when my mother in law passed away unexpectedly, and my father in law, obviously devastated. We were all devastated. But one of the things that he said to me that really, really stuck was, "You're so cold." And I would explain to him, I'm not. I'm just, we deal with death differently. We deal with things differently. And I think a lot of the public, as well as other disciplines within healthcare, see us as almost losing our humanity. And you're full of these, going back and researching your content. Like I've watched it, for some months, very casually, of course. But once you agreed to be a guest, you go back and kind of listen. You are full. I don't know if these are yours all the time, but you are full of these great quotes that I just hinge to and, have even started using in my leadership and things that you said. And one of them is excellence doesn't equal the loss of humanity or humility. And you changed that a little bit and I added some words there. But that was the basic idea that I gained from that is like this excellence doesn't mean that we can't be humble or still have our humanity. For the burnout provider, how do you sustain that type of excellence without becoming the kind of cold that I was accused of being, without appearing to be cold?
Yeah. So I actually use another quote a lot. Some quotes I will always make sure I give credit to anyone that I do use quotes off of, but a lot of it is just me. I love to blab. I love to yap. I will just say a lot of things. So a lot of it is mine, but I will give credit where credit is due. But there is another quote that I like to use a lot of chasing perfection to become perfect, you'll fail. Chase perfection to catch excellence and you'll succeed. So this is kind of one of those things that I use in a lot of different ways. So you talk about like not becoming cold, not becoming cynical. It's hard in this profession. And so I like to think like there's these gut checks you can do throughout this and right throughout your career to make sure that you're balancing things well, whatever it may be. And I've always used this for myself. I guess I'm the type of person that is very highly susceptible to your burnout. And I think a lot of us are. If we care deeply, we're all usually very motivated. You kind of have to be, and not to sidetrack, but right, when you think about it, you're getting these people into these programs, these paramedic programs. A lot of times in those programs, you're sitting there saying, okay, we got 60% here to help you succeed in this, but a lot of it's self-motivating, a lot of it's self-work, a lot of it, and you'll hear that a lot in these paramedic programs. So we're built to like drive ourselves and push ourselves. And right, I think that's it's a risky thing when it's not put into a boundary setting path because it's a fast track to burnout in this field if you just don't have that solid mindset. But that doesn't mean that you should lose these positive traits because they are positive. We just have to use them right to make a solid provider, and you just have to be chasing the right things. And so, right, you're not looking to be perfect. You're not looking to build this perfect skill or to have the perfect example or explanation to a patient or their family, but instead you're taking your experience and build lessons learned, and like you're refining your skills and moving towards perfect with the goal to gain excellence. Though this mindset will be much more sustainable, I feel like, than placing those traits away from burnout and more into like a more positive influence of this field and keeps you human. It keeps you, right, thinking of your patient, thinking of better improving and strengthening your system and improving and strengthening yourself as a provider versus the not the bad, but the yuck that we deal with, if that makes sense.
Absolutely. So some of that yuck that you talk about, and one of the things that I really love and resonated with me, and something that I've had for a long time, is this idea that we go through this unfiltered trauma. We are the first line defense. We see it where it is. There is no getting away from it. There is no running from it. We kind of have, and I've said this, we have a front row seat to everybody's worst day. And as it goes down that healthcare line, it kind of gets filtered, like because the ER staff doesn't see the car wrapped around the tree and the kids crying and all the things that we see on a scene like that. But you described it as a pre-hospital provider trauma as like an IMAX version of a movie. We're in it. It's the sound in your face. It's the smells. It's all the senses getting, hit at one time. So talk a little bit more about that and why it's vital that we prepare for it a little differently.
Yes. First, I also want to make a point. I just quoted a person without giving them credit after I literally just said I would do that. So that perfection quote was Vince Lombardi. So anyway,
Yes, yes.
moving on. I just realized that. Anyway, yes. So the unfiltered trauma that we see and that exposure. So I really like the analogy that I did use, and it was I don't even remember how that came to me. I actually think it was my kids wanted to see an IMAX movie. It was some weird A to B to C to D E that I was like, whoa, wait a second, there's something here.
Yeah.
But right, when you think about it, as first responders, we are seeing that trauma up front, and it's so raw and unfiltered. And I don't think we give this enough credit, just us, our own profession. Like you are seeing it, feeling it, hearing it, smelling it. Like some people go through these type of, and I wish I could remember the exact number, but there was a claim out there that said it showed like people in their lifetime, a normal person goes through like 2 to 3 maybe extremely traumatic events in their life. A first responder, it's upwards, and I don't even want to quote it because but it was a ridiculous amount. It was like
Oh, I know
200,
it.
whatever.
I use it all the time. A normal
Yes,
person will go to 3 to 5 traumatic events within their lifetime. A first responder, and this was a study done for a 10-year first responder career, they'll go through over 2,000
yes,
uh, traumatic events within their 10-year career in
and
a
here
in a mid-based system, not a busy system, a mid-range call volume.
exactly, and that's where I think when we put it into that perspective, it's insane. I mean, I don't have
Yeah.
better words for it other than that we put that through ours, and we can't, and we're gonna sit here and say it's just a job. It's why are no. Right. So right there is no small feat to your nervous system in that. Your nervous system will get exposed to that. And unfortunately, in EMS, we don't get training at all that matches this level of exposure. I mean, at all. Most training that we receive is, and I shouldn't speak for all paramedicine programs, but the formal curriculum that we have nationwide, there isn't a stint that we do any of this type of work or this exposure therapy or anything to get us ready for something like this. And we receive a lot of anecdotal and subjective information once you're in the field and you have your FTO, or maybe if you're lucky, you get like a couple hours CE presentation. But preparing for this type of exposure should be much more comprehensive. Absolutely. And I think that's why,
Mhm.
again, naming those type of statistics and looking at that, it hopefully rings alarm bells for our education system and curriculum to kind of be like, maybe we should start thinking about this as a part of our education curriculum to help that burnout and our extremely terrible retention rate
Mhm.
as being a contributor. I think it's just so obvious to me. And I think that's why it's hard for me to like really elaborate much more on it because it's like that. And this seems
Yeah.
like a very easy solution. But no, I don't have a solid I mean, right, I always advocate for people to get in front of mental health professionals as soon as you can, right, get yourself as knowledgeable as you can. There's some incredible, right, podcasts like this one and a lot of others that are starting to speak more about this stuff, have that group of people that you can be around. Unfortunately, right now, there's no solid structure to that side of our job. I wish there was. I wish I could snap my fingers tomorrow, and I just think it would make an insane difference. And, I'm not saying we're the only healthcare discipline that has to go through this. I think it is a healthcare issue
Sure.
systematically. But what I do like to always refer back to is that when we talk about that analogy with the IMAX movie, is we're the ones that are truly seeing it up front every time. And even when you go through those ER doors, there is a level of a lens that they even get. And I've actually talked to a lot of, well, I have a video on it.
Hmm.
I
Yeah.
and I will remember that to the end of my days is like having someone like an ER physician being able to admit that like you guys are seeing this, even the directedness that we're kind of told that we have, it's like you guys have it at another level, but it's not even talked about. So yeah, I wish there was a better way that we did that in a better, a more structured way. I think it would change our profession for the better. Unfortunately, right now we're kind of trying to now patchwork it a little bit,
Yeah.
and so it is a very it's self-motivating work, unfortunately, and that's why we lose so many people out of this profession.
Yeah, and to your point, I feel like the education part is a big part of it. If you would involve that curriculum into our EMT programs, our paramedic programs, our continuing education requirements. And to shout out two former guests, two people that are really working hard to make that happen are AK Designy and Alex Jabber. They are phenomenal. And if you ever want to recommend resources for that kind of mental health stuff, theirs are amazing, amazing
Right.
resources. AK's book is Beat the Burnout. It's one of the best books I've read all year. And part of that burnout, I think, comes from this IMAX version of this trauma that we see. But for years, we've kind of talked about burnout as if it is some kind of rite of passage. In our career, we're supposed to get burnt out. That's just what we do. And we keep going, we move past it, and we get
And the
over it.
tough ones survive,
And the
right?
tough ones survive. Yeah, I hate that.
Me too.
How is this experience with all these traumas that we see, how does it lead into burnout, and why do we have this burnout epidemic in your opinion?
Well, I think it is, man, that's a loaded question. Our burnout epidemic, I like to believe, is vastly attributed to this constant disconnect that we have between the system and our profession. Like you were saying, the culture of being tough and being, rigid and cold and cynical and dark humor, and like it's looked at as almost a positive, like you're in the club if you can become that. You know what I mean? And I'm not saying that there's anything wrong with that type of personality or lifestyle, or that is totally fine. What I'm saying is it's extremely limiting. And so the people that maybe aren't necessarily that, they're all of a sudden not supposed to be in pre-hospital medicine. And so then they kind of get booted. And so then they go into, or right, they end up with a lot of moral injury, burnout. They end up going out of healthcare completely because of that experience that they had. I'd like to think that if we opened it up a little bit and looked at it for truly what it was, and seeing that this culture maybe isn't the most healthy and the most, and I'm not saying we all have to be daisies and rainbows, and I'm not saying that. What we see, what we do, it does take a little bit of tenacity. It takes higher acuity levels. It takes higher performance. I
Mhm.
fully understand that. You can't be kind and nice and right, but there are more structured professional ways to build that type of provider than the way that we do it, where it's very, like I said, like subjective and anecdotal off of like your FTO or who, like it's,
Yeah.
and hopefully that answers it a little bit for you. But I think that's where a lot of that burnout comes from, is it's such a specific type of, like, like even I can attest to this really with moving into mobile integrated health and talking a lot about that. Whew, some of the people, it's incredible to me to see something that is without a doubt, without a, I mean, every program that has started, for whatever reason that they may have gone away or they've continued to grow, every single one has showed how impactful this is to patient outcome. And isn't that why we're in this already? So what ends up happening is people start to see it as, oh, they're trying to push us into soft skills. They're trying to push us into, not doing all the exciting stuff. And I try to really I didn't realize how much pushback I would get against my own profession to do something that I
Yeah.
thought we all were here for, was to,
So this is great, and thank you for being so open and honest about your opinions in the mental health field. But I want to know about this mobile integrated health. So we have very little of this where I am.
yeah.
So where I'm actually living is rural North Mississippi. I work in Memphis, Tennessee. They have kind of a version of this, but it's not out there as much as it could be. And I don't have really any education about this other than the paramedic school 10 years ago saying community paramedicine is something of the future. So the future's obviously kind of getting here. So tell us what mobile integrated health is.
Yes. So mobile integrated health. So it is a newly formed and forming healthcare delivery model. And I'll start with mobile integrated health and then I'll move into community paramedicine. So mobile integrated health, it's this healthcare delivery model that is truly trying to serve better patient outcome, system efficiencies, and empowering paramedicine and pre-hospital providers into a progressed profession. And how we're doing that is we're meeting patients truly where they are. So we're truly trying to find these patients, and it's very community specific. You have a certain community and you could pick them anywhere. I mean, think of yours right now and think of the things or the high utilizers that you see through your 911, the high utilizers you see through your ER. There's usually a common denominator here. And so what we do as MIH professionals is we try to mitigate this. So we try to understand, why are these people coming time, and this isn't the only portion of MIH, but this is a good portion of what we do as paramedics in these type of roles. Is we try to see why these people are utilizing 911 in a non-emergent setting. So like why are people, we have like a lot of lift assists. Okay, well, lift assist, why is it important to get ahead of people? It's all preventative measure. You want to get ahead of those lift assists because the fatal fall. You don't, we all know, we've seen it. We get called to 4 or 5, 6, 7, 8, 9, 10 lift assist, and then we get called to that 11th and it's broken hip. Now they're going and living the rest of their days in a skilled living facility. So what we try to do as MIH professionals is be preventative. Let's make this patient outcome better. Let's change this trajectory. Let's make our system more efficient. They don't need to run through the 911 system every couple days or every day, or and then let's empower these paramedics and give them dynamic pathways to treat these patients. And it's hard to really generalize it because it looks so different everywhere around. So I do try to keep it high level with that. Like the main goals really are, it's a healthcare delivery model that strives on preventative measures, and it's really to impact patient outcome, system efficiencies, the paramedic profession, empowering the paramedic profession. We use community paramedics. So that's why I like to look at it. MIH is like your umbrella system. It is this big overarching framework that is mobilizing healthcare in just a new format. Community paramedicine are these primary providers that you have in this umbrella. So paramedicine, pre-hospital, it is truly championing this and saying, hey, we're here, we're accessible, we can do this. This is our wheelhouse. I talk a lot about our inherent, triage measures and what we are able to do walking into a home, and what we see as paramedics, it is different than any other healthcare profession or healthcare discipline. Our environmental diagnostics, what we see, we already know this, all this stuff that we see, and we're like, yeah, Mary Jo down the street, you know why she keeps having a COPD exacerbation every week? It's because I've watched her try to smoke while using her, whatever it may be. Like, you see this stuff. What happens is there's this huge disconnect between our assessment and our understanding of the situation, and then how it moves into our handoff with the rest of the healthcare profession. MIH is gapping that. MIH is putting paramedics a part of these teams in a lot of different formats. Some are more, my personal program is very integrated into a hospital system, so I am very much involved in the care team. There are others that are EMS, so fire EMS based models, and they're striving a lot more on, so like you'll see your high utilizers for your 911 system, they'll kind of tackle those and look in, same idea, preventative measures, trying to get them to the right resources at the right time in the right place. Look at SDOH a lot, so social drivers of health. That is a huge portion of it, because you can see time and time again how these SDOH measures are pushing clinical outcome. Even though they seem environmental, even though they seem social, socioeconomic impact has a tremendous correlation with your trajectory and
Absolutely.
your outcome.
Yeah.
So that was kind of in a nutshell my quick
No,
fire
that was
deal, but
no, that
that's
was great. And but it raises a question. So for me being a 911 paramedic for the last 10 years, EMS for 20, what's the difference in education when you talk about a community paramedic? Because I know there's an additional education that you have to take to get your community paramedic. What is that? What are we learning that we don't already know?
So think about it, and the best way I try to explain it, and I actually, so I'll be honest here, had the same thought when going into MIH, and then I started doing MIH and going on to these visits, and I understand now very
Well, I
much
didn't mean
so.
that to sound as rude as it may
Oh, no, no,
have.
no, not at all. Because I think you're definitely not the first, and you will not be the last person to ask me that. Because it's like, so wait, you don't know what you don't know. And then once you move into it, and the way I like to look at it is think about, and I don't know if where you're from, this is as common, but we have RN exempts in Iowa. So we have nurses that our medical director can literally sign a piece of paper and say, okay, this nurse can now act as a paramedic, have a full scope
Yeah.
of a paramedic.
Yeah.
There is no requirement to service-based to have a requirement of, like, gap skills, so, right, in intubation and things like that to teach these nurses to be proficient in pre-hospital, but there is no set measure, and so what happens a lot is the nurses are like, "Well, right, what wouldn't I know? I mean, surely I can understand this," and it's what happens is it's the foundational aspect, so it's like your EMT basic stuff that, like, yes, you know pharmacology, you know this stuff, but it's the
Mhm.
basics, it's like how you think about it and how you go about the patient interactions. And right, when you go into an MIH call, it is a whole different interview process, assessment. It much more mirrors like your primary care than it will your 911. So you're learning that side of it. You're learning those extensive assessment models. So you're looking in more like longitudinal assessment. So you're looking, right, 911, it's like, okay, are you bleeding? Are you breathing? It's like we're very much like sick or not sick. Well, MIH is much more comprehensive than that. You're learning a lot of plan of care. You learn a lot of how to develop plan of care in MIH. And again, I'm speaking purely to my experience. There's a lot of different variations. A quote I always like to use is once you know an MIH program, you know one MIH program. Every program right now is just a little different in how they go about everything. But I think we could all agree it is just a different pace of 911. And it's that foundational work that you need to really understand. And I will say, the socioeconomic side. That and I will argue even in the 911, profession, we should know so much more about this of true, like, social work, and not saying that we need to be a social worker and we need to go through a entire program like our licensed workers do, but what I mean is, like, we need to understand the high level of, like, that type of, like, the motivational interviewing and how to speak to these patients and how to, truly build with them, whereas 911 is very much like, "Hey, this is a case for 30 minutes of mine. There's a start and there's an end here." Like, it's a lot different. There's a lot of that, and lastly, it's really your extensive understanding of, pharmacology, and because you see a lot, like, your meds and you know a lot, and you come into contact a lot in 911 with more chronic medication, your more day-to-day medications. In MIH, you are doing full med reconciliations, and when you're sitting there doing full med reconciliations with patients, they have a lot of questions, and so understanding and a full understanding of your medication pharmacology, that's probably one of my biggest ones that I almost want to take a whole course of just advanced
Yeah.
pharmacology, a nursing program or a nursing course just to get a better understanding of that. So that's hopefully, I mean, I feel like I'm saying a lot of words that maybe hopefully are answering your questions, but
No,
yeah, that
I'm gaining from this. I'm super interested.
but, yeah, I didn't mean to deviate too far into the whole MIH spiel, but that is really the bread and butter, and it is just a totally different form of thinking, and it's so hard for me to put into words sometimes when I'm putting content out there of, like,
Yeah.
how it changed, because it's so long form. I'm like, "Gosh, I don't know how to say all of that," what that was probably 5 minutes of, how do I say that in 30 seconds? How do I explain to a 911 paramedic, like, "Hey, this is advanced. This is challenging you, and it's not a soft skill. It is truly directly changing outcomes for patients." And to lead back to what we were talking about with that burnout, it's like when you are a 911 paramedic, you're getting told time and time again, like, "Yeah, you know why this patient is X, Y, and Z, but can't do anything about it. Hands are tied. I'm just a medic."
Right, right.
MIH is truly pushing you into that role of like, "Oh, no, here you go. Here's a toolbox. This is," let's see it. Can you make changes to these patients? And I think that's what's so satisfying to me about it is I sat in that way for so long as a 911 medic. And maybe not everyone feels this way. Maybe people are like, hold up, 911 is, I can start, I can end. I don't want to mess that up. But for me, it was always like, "No, I see it. I get it. I wish I could just, like I wish I could just do this," or,
Yeah.
there's a little
Yeah.
more dynamic to what we can do, and I recently talked about hospice patients. It's like, we should not have to force these patients out of their home just because we don't have the correct legal backing currently right now. Even though they're calling us, even though they need this, we can't do anything because no one has actually pushed for dynamic pathways yet.
Sure.
MIH is just one of those, and it's becoming a complete different sector of paramedicine, and who knows? And it's really doing that because it's trying to build right now, but who knows what it's gonna look like in 5 to 10 years? Will the entire, EMS profession become more dynamic like this? Will it just absorb all in together one? I have no idea. But what I can say is it very much heals a lot of that moral injury that comes from that side of it, where it's like, you know what the right thing to do is, you
But you
just
can't.
do it. So
And one of the things that aggravates me the most about the profession that we chose to get into is, and you give this challenge to leaders in one of your videos. Like I said, I love your quotes, and this one is especially my favorite. But you said, if you want the big dogs to quit bastardizing our profession, stop letting them. And I think that doesn't only happen to our profession as a whole, but I think it happens kind of independently. So there's a lot of people out there that I've heard say community paramedics are home health. And I think it kind of does exactly that. I think it completes that action of like, oh, you guys are not real paramedics. You need to get off the scene, like that kind of feeling. I mean, what do you say to that? Why are we as EMS as a whole so bastardized for what we do? And why is community paramedicine kind of pushed out to the side and people kind of say, oh, that's just home health?
Okay. So,
I gave you a long questions.
yes, you did. So to break it up, so yes, if we want the big dogs to stop bastardizing our profession, we got to stop letting them. So, man, so this is the way I like to look at it. And I am not one sitting here on a silver platter saying, hey, all of you, you're not doing this right. You're not, I fully understand where I was even at a couple years ago. Like you don't know until you're breaking out of it that you're like, whoa, yeah, this is not working. We EMS professionals sometimes are our own worst enemy. And it's a lot of what we talked about today. We are selfless. We are like, there are some incredible, incredible people that are part of this profession because of who they truly are. But unfortunately, with that selfless nature comes the best way I can, right? It gets taken advantage of. And we let people walk all over EMS. And something I like to always reference back to is when I first started at one of my positions or one of my services, I remember kind of voicing like, "Hey, this doesn't feel right. This doesn't really feel right. This seems kind of wrong." And like, "Oh, hey, we're the medics. Like we got to pick up the slack. We got to do this. We got to." And it's like, "No, no, no. This is crippling us. This isn't working. This is, I understand we all have to be a team and work together. And yes, there are much bigger issues in the system than what we can solve, but relying on paramedicine or EMS to solve all these and without the appropriate support, the appropriate backing, the appropriate legal standing, it's crushing people. It is moving people quickly out of this profession because right, it's not working. And so right, and that's what I kind of always like to say. We love to get on and talk about like we are taken advantage of, and no one's wrong. Everyone is very right in that. But then we got to stop letting them. We got to stop we have to take a stand somewhere. We have to understand our boundaries. We have to understand where EMS is. And if we want to move it forward, right, let's talk about it. Let's move forward. What are our ideas? What is
Yeah.
MIH valuable in this sense of like right, we can actually be a part of the healthcare system now, or we can be looked at as a part of the care team. That's a huge, huge undertaking to and right mindset shift for just healthcare as a whole. And really just that's kind of the way I like to explain it is I think selflessness is an incredible trait to have. We just have to have those boundaries and understand that we also have to stick up for this profession and us as professionals to be able to move forward. Otherwise, we will continue to crash and collapse, and they'll figure something else out to have people being taken care of in these systems.
Yeah,
And
absolutely.
what was your other portion of the question? I can't remember.
So basically, I kind of feel like that I've heard people in our area and on the internet talk about this community paramedicine MIH as kind of this home health, and it kind of
Yeah.
almost sets you guys apart and like, oh, they're not part of the EMS system. And it kind of bastardizes you, in your words. So, I mean, what do you say to those people who say this is just home health?
Yep. Well, and anyone that's on my current service that watches this is gonna laugh because that was kind of the running joke and still is the running joke of what I do. Granted, they're great and they're supportive and they have definitely the more they knew, the more they're like, "Oh, yeah, this is actually helping our system." But you're right. So this is another one of those, I think, coping mechanisms that people have of change is so much, so very hard for our profession. It is, and I think with anyone, I think healthcare in the whole, we can probably agree that that is an overarching personality trait. But so, right, it's kind of the way that they say, like, hey, yeah, nope, let them do their thing, let them have their pet project, let them, figure this out. Like they'll do their home health and be merry on their way. Unfortunately, that's just kind of one of those things you have to explain to people and explain that because here's another thing. I think it's a defense mechanism where they don't want to be told that they have to now do more when it's already that they were saying like, "Hey, this isn't working." Right? Something's going on with this profession that like it's broken, and then we're like, "Hey, how about you guys do this too?" And right now start filling these gaps where healthcare needs you to do it. And I think there is a little bit of that of like, no, and that defensiveness comes on, so which I can understand. But that's so once I kind of try to explain it to people, and I have a very much an earlier video, is like one of my first, I think. I talked a little bit about this quote because I hear it so often. I talk about the differences of what it is versus home health and, how it's more of a community resource versus like a long-standing service. But primarily it is just being patient and it is talking through these things. And anyone that is going to start this type of program has to understand that it's not just going to be widely accepted because you think it's a great idea or you see the benefit. You got to have a little bit of understanding that it's going to take some time. Any system, I mean, ours is a critical access hospital. It's a relatively small system, and I still work through these conversations with people. But yeah, I mean, it's really just sticking to what you know and what you believe. And I think, and even now I see it in my own exposure. I mean, even our state level, I have the Bureau of EMS now talking about how they see this being a benefit and understanding the difference between home health and what we are doing. And so it comes. And I hope that gives someone, if anyone is considering this, like that is very much something you will run into. You just have to understand how to speak about it and talk about it in different pros and cons and the differentiations and all that, and stick true to it. So
And I think doing this kind of interview is beneficial because I've gained so much information from just your answers. And I have
good.
extremely enjoyed this, but I think that one of the things we do as professions is we refuse to acknowledge that we're not perfect. And again, one of the quotes is normalize imperfection out loud and people over optics, things like that, that we so oftentimes just get away from. And I think this is part of that is the reason we kind of have this reputation for eating our young and, this idea of bastardizing each other in different roles, because I really don't think paramedic was ever meant to stay as stagnant as it has. I think it was meant to branch out and meant to do different things. And I love this whole idea of mobile integrated healthcare and community paramedicine. I think it is very cool. As you're talking, I'm having patients run through my head that like, yep, they could use that. Yep, they could use that. But I think we kind of get into this mentality that we have to be perfect in this. So why is it hard for us as performing professionals to admit this imperfection?
So I think there's a lot here. So I'll try to narrow this one down. There's a few. So first and foremost, I feel like we're trained in this culture of like performance. Like that's what we're based on. Like and it's a very specific trait. And we kind of alluded to this earlier of like, you're supposed to be the calm one, the competent one. You're never cracking under pressure. Like you're just looked at as like, you got it. Even if you're brand new, like that is like, nope, that's you. You're on it. And so, right. So then somewhere you start, I think, confusing that professionalism with perfectionism, thinking that, yep, if we don't get it 100% right 100% of the time, you're a failure. And that, right. So then, secondly, like it's this fear that if we admit it, so if we say that, right, we're not perfect, which is crazy to say, like, it's like, why would that ever be an expectation? But when you're in it, it feels a lot scarier. It discredits our skill. And I think we're always on defense about our skill anyway. So I think there's a lot to that too of like, we're already always saying like, yeah, I'm a paramedic. I can intubate and I do it often. I can RSI. I can
Yeah,
just any of the
absolutely.
insane advanced skill that we do that we always have to we're always a little devalued or misunderstood. So I think there's a little bit of cynicism when it comes to that too, and it isn't internalized, and then in your culture it becomes that. So right, if we're saying, "Hey, I struggled with this. I don't know that," or "I don't really understand MIH. I don't understand why this would be right." Or even when you start talking about like your calls and, "Hey, I actually wasn't calm at all. I was freaking out." People think you're less capable. People think you're like, "Oh, you can't hack it then." So then we start to build this culture of like, "Okay, just hide it and fake it till you make it." But this is not the profession to do that in. That is extremely harmful mentality to have when you're going through extremely intense traumatic exposure, especially with some of these people that are as young as 18 years old coming into this and doing things like that. It's just extremely, extremely disheartening to see sometimes. But yeah, to get back to what we were talking about, when you're saying it out loud, you're giving, I think, people permission to stop performing. So when we start talking about this, when we start saying this stuff on the internet or, on these podcasts, we're shifting that culture just a eensy bit. Like there's a few people that are like, oh, okay. Like, and then you stop isolating yourself and then you stop pretending and then you start to get curious and then you start to, it builds and compounds into this, what now we can call, you get your humanity back. Like you get back this presence of, I'm imperfect, but I'm motivated, I'm competent, I'm strong. But yeah, sometimes that freaked me out. That was nuts. I cannot believe I just saw that and you can say that and it is so much easier then to build into that and
Mhm.
then to then build on that like with MIH. It's funny because I don't think people see the like how that can correlate to now the progression of our profession. It's like, well, how do those two things connect? But I hope that that gives it where it's like once you build those type of people and you give them that sense of, hey, imperfect's fine. We understand you. We see you. Right. We want you to still be built into this. You're still high performing. You're still able to handle a whole hell of a lot more than
Yeah,
a lot of other professions. But
that's right.
at the end of the day, that allows those people to then get out of that fight or flight 24 every right if you're on 24/48, so every third day of their life, and they're then able to create, they're able to think, they're able to get curious, they're able to open up to new idea, and then it completely expounds what this profession will look like.
And I think we put so much pressure on the fact that we have been just ingrained with this "we save lives" mentality, and we have to save the life. So when we don't succeed at that, it's this big devastation. You put it a little different way. You've kind of shifted a little bit of thinking just for me sitting there aimlessly watching TikTok my personal TikTok page has become pretty much my son's. He just watches like kitty stuff on there. And then my Silent War Within page has become my primary. So it's what I just watch all the time. And as I'm watching, I'm like, we sustain lives. Cause that's what you say. We sustain lives. We don't save them, we sustain them. And I'm like, that makes so much more sense than what I've been. So can you just quickly expound on that sustaining lives and what your thought in saying that phrase is?
Yeah, so another great quote that I heard from another creator. So the pre-hospitalist on Instagram, if you
Yeah.
don't know her, yeah,
Yeah.
she's great.
Love her.
Really real. Like, she just keeps it real. And so she kinda brought this idea at first. I can't remember she had a full kinda spiel on it, but what I really took from it too was this whole sustaining versus saving. And so it kinda shapes how I feel like I talk about this, or it gave me words to be able to talk about it because I think I understood it, but then it put the words there. So, right, I get and mine kinda came from the MIH side of, like, when I hear people say, like, "My job is to save their life. It's not to worry about their feeling or feelings of whatever it may be." And you can even put this in the 911 sense of where
Sure.
people are human beings to other human beings. And it seems to be demonized for some reason. And so I like that where it was like, no, your job isn't to save their life, it's to sustain it. It's to sustain them. And right, saving a life, I feel like definitely implies that you have like full control on like a full reversal. You have all this, yeah,
And you
almost like a
definitely do not.
God complex a little bit.
Yeah.
It implies, yeah, that the outcome is purely in your hands and right, you gotta make it work. And but in EMS, that rarely is the reality. I mean, even you look at just paramedicine as a whole, we do not control outcomes. We are controlling the interventions. So we aren't determining who's living or dying. We're responding and stabilizing and then you transport. But sustaining a life. So that's what we're doing all the time. we are managing so much at once. It's not just like your skill level. Like you can be incredibly good at your job as far as like your innovation record and your IV starts, your
Mhm.
CPRs, whatever it may be, but you can still be really bad with people, and that is gonna profoundly impact, like, when you're sustaining their life, that you're taking all of that into consideration, not only your skill level, but, like, your comfort, your stabilization, your coaching, your advocacy, everything together is the sustainability of that, and you're fighting for that best possible outcome, and with right, your tools are the time that we do have and allocated, but right, when you're reframing it changes how you're relating to that success, and especially, like, how you're relating it to success versus failure. There's just so much to say about this because yeah, if you believe your job is to save lives, then every death is gonna feel like a personal failure. Like, it's gonna feel like I had full control and
Mhm.
I wasn't able to save them. Every non and I'm kinda diving into a different aspect of this, but every non-reversal, so, like, every right, you didn't do it, you couldn't save their life. You're gonna feel like you're not good enough, and that mindset is going to absolutely destroy you as a provider because you're carrying a whole lot of responsibility for something you actually had no control over. You can't have it all, but right, if you have that sustainability mindset, you're giving that patient, like, your best assessment and then your best interventions and your presence, and success then is defined by, like, your care, not just, like, your outcome. So I hope that it's a very dense topic, but it's
Yeah.
really just that matter of like sustaining is the all-encompassing aspect of what you do, and you can do that on 100% of your calls, whatever it is. And then the whole saving your life, like truly that 5-10% of what you do is gonna purely be dictated on your innate skill level. Like, yep, this innovate they will die if you cannot get this innovation. So it is still important to have that, but to be a truly all-encompassing paramedic. It's like that you have to think about sustaining their life in any way that may apply, in that setting. So hopefully
No,
it's a hard one, but hopefully that
that was great, and I really love that. It's a good spot to start to end because that man, that whole concept just helped so much. If I would have had that 8 years ago when I went through some of the toughest calls of my career that really almost did me in mentally and made me like, I'm done with this. If I'd have had that mentality, it would have been completely different. Cause one of the things, I've gotten to where I'm starting to go around and speak. And one of the things that I'm presenting is that particular call that really had the most effect on my mental health throughout
Mhm,
all the probably thousands. I don't know the number, but of all the calls I've run, that was the one, and I kinda present that story, and one of the things that I put in it is that I felt like I couldn't save him.
mhm.
Yeah, I felt like I didn't do enough, and all these natural feelings that you kinda have, and I think a lot of it comes from that pressure of, like, you're the guy, like, you've gotta do it, it's all on you, and really, that's a great way to look at it, that sometimes it's not, and most of the time, it's not on you, that 5-10%, yeah, maybe.
Mhm.
It's basically your skill that's going to save their life, but other than that, most of our calls are not solely based on us. It has outside
So many aspects,
factors to it, yeah. So if you wanted everybody to hear one thing from your podcast, what is it?
man.
I always love this question. I ask everybody this question. It's
That's
always the
such a
same response.
loaded
It's this
yeah,
I
right. I
know,
have
yeah.
so many things, but I think primarily, um, your Your work matters more than you think, but not for the reasons that we've been told our entire career. It's not your big saves, saving lives. It's not like you're being the hero or right your flashy calls that people seem to right kind of fantasize and obsess over in this profession. It is truly in whatever way you want to look at it, it is your presence and your consistency and your humanity that is going to not only heal your patients, but to yourself, and it's gonna give you more meaning long term than any of the other stuff. It's really just paying attention to it and not being afraid to share it with others. Any of those small shifts that you can make is going to be what changes the culture and then changes truly what paramedicine ends up becoming.
I love that. I have always said for years that presence is such a powerful tool.
Yes.
Yeah, and if we use it right and make ourselves a little bit more emotionally available to our patients and just resonate a little bit with them. I mean, you don't have to dig into their lives, but
Yeah.
one of the favorite things about being a paramedic was sitting on the bench seat next to a patient and just having a conversation.
And I think people are scared to dive into that even a little bit because they, again, like I said in the earlier part of the conversation, was, we don't have to turn into this, hey, everyone hugs and feelings and love. And I'm not saying that. I'm saying there's just a balance. I think there's truly a
Sure,
balance of when you're in
sure.
healthcare and you'll look at it from provider base to nurses to techs to
Hmm.
surgeons, anyone, they will all sit there and tell you your presence and your consistency with your humanity with those patients is going to get you 1000% farther than any high acute, high risk skill level that you have, you know?
As always, part of that, and I say it every show, part of that is the mentality that it is absolutely free to be kind. You can be kind to so many people and it just changes so much. Well, Sam, I think you have been amazing. I have loved this so much.
Yeah, me too.
And that is me honestly talking. That's not me reading a bullet point. That is me telling you I have sheerly enjoyed the last hour of speaking with you. And I think you brought some great insights and you've taught me a lot in the last hour. So that excites me. I always love to learn new things. And I did learn a lot about MIH in your interview. So thank you for joining us.
Absolutely.
You are absolutely a precious resource to the TikTok world. So I am happy that you are there and sharing information and encouraging. And guys, as always, you can find us on all the social media platforms. New episode drops every Friday, and we will be here as long as you guys will continue to support. And we love all you guys, and we want to be here. If you do need something, we are easily accessible. You can get to us. We have an entire team that helps us with any type of peer support work that we reach out and do and speaking and things like that. So we do have a team of about 4 of us that are really, really dedicated to this cause. So if you need something, reach out to us. Sam, again, thank you.
Absolutely.
And guys, as always, be safe, take care of your mind, and we'll talk soon. Goodbye, everybody.
You've been listening to A Silent War Within. If this episode resonated, please subscribe, leave a review, and share with someone who needs to hear it. Remember, you're not alone and your well-being matters. It's time to end this silent war.